Movement is a part of who we are. Our ability to be mobile gives us the freedom to go where we want to go.
Multiple sclerosis interrupts the flow of information between the brain and body and stops people from moving. Every hour in the United States, someone is newly diagnosed with MS, an unpredictable, often disabling disease of the central nervous system. Most people are diagnosed between the ages of 20 and 50, with at least 2 to 3 times more women than men. MS affects more than 400,000 people in the United States and 2.1 million worldwide. Symptoms range from numbness to tingling to blindness and paralysis. The progress, severity, and specific symptoms of MS in any one person cannot yet be predicted, but advances in research and treatment are moving us closer to a world free of MS. Physical therapy plays a vital role in managing symptoms and improving quality of life in people living with MS. We hope this video relays this importance and excites you to support this new collaboration between the Eastern Chapter of the National Multiple Sclerosis Society and the University of North Carolina Division of Physical Therapy.
Our chapter is the Eastern North Carolina area. We cover 49 counties in Eastern North Carolina. We provide programs and services to people with multiple sclerosis and their families. We also educate healthcare professionals, and we provide money for research, hopefully into the cause and cure of multiple sclerosis. And we also do advocacy, both on a statewide and a federal level and on individual level with people with MS. This program actually started at a clinical advisory committee meeting that we had about 1.5 years ago. And we were trying to find a physical therapist who would be willing to go and speak at the statewide meeting to talk a little bit about multiple sclerosis, and we honestly had a difficult time finding someone who felt comfortable doing that. So kind of had this discussion about trying to educate and bring about more people, more therapists who would be comfortable talking with and working with people that have multiple sclerosis. So that's sort of how the collaboration began. We know that physical therapy is a very, very important part of the healthcare team with the rehabilitation, and a lot of people talk to us about not really having physical therapy, not really having it recommended by their physician. So we wanted to try to do something about that and really sort of educate people who can be the go-to folks for people with multiple sclerosis.
So as a clinical advisory board, we began to think about it, and I guess they asked me what I thought, and I said, you know, really, if you educate students, that goes a long way, because each student goes out in their separate parts of the state of North Carolina or in the nation and really begin to educate other therapists and work with countless patients, and probably will work with students over the years, and so it will just grow. So if we begin to offer a scholarship to our UNC students each year, to think how many we could educate and really have students better understand this disease. So with that, we really began this first year, and it's just been remarkable, the energy that's been behind this, and already how it's growing beyond our dreams. I mean, truly it has. It's been very exciting.
We are so honored to be a part of this collaboration between the National MS Society and the Division of PT. We're so honored to be the recipients of the first scholarship offered in this area, and we really look forward to developing a professional relationship with the community of patients with multiple sclerosis.
One of the things during this first semester of the scholarship track that I have been able to gain is the relationships I've made with people in the community. I've had the opportunity to meet many physical therapists as well as neurologists and also patients. And that's something that provides an invaluable experience, because we actually get to learn what it's like to be someone who has MS and what it's like to treat someone with MS. And that, of course, is our ultimate goal of being on this education and scholarship track, is to treat patients with MS from a physical therapy standpoint and to make a difference in their lives.
Another thing is that Eric and I are both in the demographic and the age group that MS usually strikes. So it's kind of touched us in a personal way. We really want to work to improve the research and help the society find a cure and really help the patients that are already stricken with the disease find ways to better their mobility and quality of life potential.
One of the benefits of physical therapy is number one is understanding the various muscle groups involved in walking and understanding which muscles I have problems with as a result of multiple sclerosis. So I'm able to work with my physical therapist with exercises that help develop those muscles, or at least compensate for the ones that are weak.
And I've been a therapist for, 25 years. But 3 years ago, things really changed for me because I was diagnosed with MS. And it's amazing how I was on one side of the equation for all those years, treating people with neuromuscular diseases. And suddenly, I was on the other side, really understanding what it felt like to be a patient. So it changed my life, of course. And I guess it began to, I got immediately more involved with the MS Society. I have a sister with MS, so I've always been engaged in trying to understand the disease and do a lot of different activities, but this brought it to another level. So, yeah.
Another reason that MS is so interesting to us, and the reason that we want to pursue this in our careers, is because MS does not limit the lifespan. So it really provides an opportunity for physical therapists to have an influence in these patients' lives. Through this education track this semester, we've had the opportunity to specialize some of our projects in our courses to focus on MS. So we've really learned a great deal about the current research in MS. We've learned a lot about the medications as well as physical therapy techniques. So we look forward to applying what we've learned through our course projects and research to patients once we're out in the clinical field.
I would teach them the basics of working with any neurologic patient, and then extrapolate that into the specific problems of MS, and also help them to gain a broad knowledge of how different each person with MS is and how to alter your therapy program to each individual to meet their needs.
I've been doing physical therapy off and on for 2.5, 3 years now, and the main differences that I notice is I have more confidence in my walk, in my gait. I have better balance, and I'm not as prone to fall. And as a result of that, I have less fatigue, and just overall well-being. I feel much better about myself and my ability to move around.
We've also had the opportunity to do some fundraising for the National MS Society, including the Walk for MS, the Bike for MS, and now the Dinners Out event.
As graduates of this specialty track and as future physical therapists, we hope to work with patients with MS to provide a real difference in their lives, to allow them to maximize their potential both physically and mentally so that they can achieve a healthy lifestyle with MS.
From us, thank you so much for coming out to this Dinners Out. I hope you had a great night and learned a little bit here about multiple sclerosis.
Thank you for coming tonight to the MS Dinners Out. With support from volunteers and donors like you, we can continue to expand this groundbreaking program that will provide vital outreach and help improve access to healthcare for over 4,600 individuals living with MS in Eastern North Carolina. MS stops people from moving. The National MS Society exists to make sure it doesn't. We ask you to join us by making a tax-deductible contribution to the National MS Society Eastern North Carolina chapter so that we can provide needed scholarships for 4 UNC Chapel Hill physical therapy students who wish to enroll in the MS curriculum. Thank you, and we hope you had a great time.
Mm-hmm.